San Francisco is often in the headlines with stories of open drug use, overdose, crisis. But that's not the whole story. Something else is happening too. People are recovering from substance use disorder. They're rebuilding their lives. And the public health response behind it is grounded in something simple but powerful. The understanding that substance use disorder is not a moral failing. It's a medical condition. And it's treatable. We have evidence-based medications like buprenorphine, street outreach and telehealth navigations that connect people to treatment options, public health campaigns that foster empathy, not stigma.
Recovery for me means a second chance, and for me, methadone helped me get that second chance.
Since we stopped using, our life is like night and day. I'm able to withstand cravings. I don't have body aches.
That can be anyone. Anyone can do it.
Recovery is possible if you let help you. It's never too late to recover from addiction. I am living proof that recovery is possible.
San Francisco is showing what it looks like when a city chooses science, compassion, and care. When it treats addiction not with shame, but solutions. This is Empathy Affect, Forest Marsh Media's podcast that explores the human side of government. I'm Melissa Szynski, and today we're joined by Dr. Jeffrey Hom, Medical Officer for Science and Policy at the San Francisco Department of Public Health's Substance Use Services. Dr. Hom is helping lead the city's efforts to transform how we understand, think about, and respond to substance use disorder, or SUD. From researching how media imagery shapes public stigma around SUD, to designing campaigns that center stories of recovery, and providing access to telehealth care and harm reduction, Jeff's scope of work bridges evidence and empathy in this field. So let's get into our conversation about science, storytelling, and what's possible when we stop asking whether people deserve care and start building systems that deliver it. Jeff, welcome to Empathy Affect. It's so wonderful to have you on the show to talk about your work in San Francisco today.
Thanks so much for having me.
Of course. So I just wanted to start by talking about your really intersectional career. You know, you've worked in public health, medicine, academia, policy, really well-rounded. And through your journey, though, you've decided to focus your career on substance use. So can you start by sharing what drew you to this field and how you ended up returning to San Francisco after working across different parts of the country to serve the city that you originated in?
Yeah, absolutely. So my first job out of college was working back in San Francisco in our Tenderloin neighborhood, which is really the epicenter of the city's overdose crisis, high numbers of individuals experiencing homelessness. And it was there for me, hearing the challenges that were facing our clients, some of their health issues, their social issues, and just hearing their stories of what led them to be, on the streets in San Francisco really compelled me to think, how is it that I could use my career in medicine and public health to really sort of think about their individual care? And then also, how could I help address the barriers or the disparities that they were facing in accessing treatment or services that I think that they could really benefit from? So I went through medical school, had a lot of experiences engaging patients, also describing their stories, many of whom were grappling with a substance use disorder, talking about some of the challenges they had with respect to their health as a result of substance use. That really made me passionate about really wanting to make this the focus of my career. So after residency, I spent 8 years in Philadelphia, 6 of which in the health department there, really sort of developing my knowledge and understanding, both from a clinical, but also from a policy and from a programmatic point of view. How is it that I could help reduce what is really one of our nation's leading public health crises right now, thinking about substance use and overdose? I've now been in San Francisco for 3 years. This is home for me. And I think despite the challenges and frankly, a lot of loss that we've all experienced here, I'm really grateful for the opportunity that I have within the government to affect some positive change.
Yeah, we'll definitely get into the intersections of your experience and how you bring it to the table in San Francisco throughout this conversation. I'm so excited to share it with our listeners. But I think it may be good to also just set the stage for people who maybe don't live in San Francisco. What, from where you sit, are some of the most pressing challenges and promising shifts in San Francisco's substance use landscape right now.
Yeah, well, unlike some other topics, I think, in public health, the area of substance use is extremely reactive. We have this unregulated drug supply. It's volatile, it can change quickly. And that leaves us to have to react quickly. We have to learn about new substances and act accordingly. Time is indeed of the essence with a crisis like this. And I think for us here in San Francisco, as has now happened throughout the entire country, the reality is that fentanyl changed so much of our work in clinical medicine and in public health. Fentanyl is 50 times more potent than heroin. It's now widely available in San Francisco, throughout California, and throughout the country. But I would say, I think what's promising, in San Francisco, we're really treating addiction like a medical condition, like a public health issue. We've expanded access to evidence-based medications like buprenorphine through our telehealth program. And we're supporting people's health through our harm reduction measures. And I think I really want listeners to sort of really appreciate that a lot is indeed happening to address what really is a very complex landscape, but there are positive steps that are being taken. We're eager to work with colleagues in the city, across the state, and learn from colleagues across the country on how is it that we can each best utilize the data and the tools that we have to ultimately save lives and reduce the harms associated with substance use.
Absolutely. I do know that San Francisco is often in the spotlight when it comes to substance use, so that can come with all sorts of perceptions from people in or outside the city. So, what's something about San Francisco's response to substance use that people outside of the system of care that, who may not fully see or understand what's going on, what are you seeing there?
I mean, I think you're right that San Francisco is often in a spotlight, whether it's people describing what they're seeing on social media. News articles have certainly highlighted some of the challenges that we do have in San Francisco. And I think the most visible manifestation that people see is really this crisis on the streets. But I think what they don't necessarily always see or is always described is sort of the innovation that's happening behind the scenes, whether it's in our health department or with our partner organizations. We distribute more than 100,000 doses of naloxone annually.
Wow.
That life-saving medication we aim to put into the hands of community members at every opportunity that we can. We have a night navigator program that connects people to treatment for opioid use disorder that's available every single day of the year from 8 a.m. to 2 a.m. in the morning. We became the first city in the country to require pharmacies to stock buprenorphine, one of these life-saving medications for opioid use disorder. And that's a policy we're now working hard to implement. Because our belief is really that not only should there be no wrong door, but there should be no wrong place or time either. And so we're really trying to build that safety net that catches people and offers services wherever they are in their continuum of use. And I think sometimes that doesn't always make it into necessarily some headlines, but a lot of, I think, really good work is happening here. We have a lot of challenges. We're continuing to evolve and to innovate our response to meet things as they change. But I think maybe that is one thing that I would offer that doesn't always sort of make the photos or make the headlines that people are familiar with when they think of San Francisco.
Yeah, that makes sense. I'm hearing a lot of humanizing people, meeting people where they're at to support them regardless of where they are, whether they're like ready to jump off the deep end in terms of like going into full treatment and recovery, or whether they're, sort of exploring that idea. It seems like you have a lot of support to bring to the table to meet people where they're at, regardless of where they are on their substance use journey. That being said, I feel like many public health campaigns around this issue have relied on fear or shocking stories or statistics to drive behavior change, maybe strike fear so that people don't even get into this kind of territory. And for substance use disorder, this approach may risk driving further stigma, but I'd love to get into a study that you and some colleagues of yours published looking at how news photography of substance use disorder affects public opinion. So can you speak to the study and some of your findings and what they suggest about the unintended consequences of how we visually represent SUD in media and policy?
Yeah, thanks so much for the opportunity to speak about this. Drug-related stigma is such a big issue in the US. And truthfully, none of our interventions, whether it's our programs or our policies, will really ultimately be as successful as they could be if we don't also address stigma. And so I think a lot about this in my role in the health department and as a researcher. But it's really, what can we do to reduce the stigma that surrounds substance use? And a lot of research has really been done on the role of language in perpetuating or mitigating stigma. So words like addict or junkie are highly stigmatizing, and they can really hinder someone's willingness to seek care. But we're influenced as humans just as much by what we see as what we hear, and little research has been done on the role of images. And this is despite images being so ubiquitous and salient in our world, in our society today. We see them everywhere. And studies have shown that social media posts with images are more likely to be shared or engaged with than those without images. And in both online or in print media, photos may be seen even if the reader doesn't read a whole article accompanying it. And so this role of images is one that's really interesting and important to me and my colleagues. And so we felt it was important that we understand what is the role of drug-related photos, especially those that are used by the US media on reporting on the country's overdose crisis, on the social stigma towards people with substance use disorders. And so recently we published a paper describing a randomized experiment that we conducted involving a national sample of a little over 3,400 US adults. They were randomized to view one of 8 drug-related photos or to a no exposure control group. And then we asked questions, about the emotions that someone was feeling in that moment, stigma towards people with substance use disorders, and then acceptance of various drug-related services. And through this analysis, we found that photos of people in recovery were associated with lower social stigma towards people with substance use disorders.
Mm.
And I think that that's, intuitive for many of us in this field, or if we think about it in other illnesses. But now we have some empiric evidence that we can point to, that we can draw upon, that I think has implications for how the press might cover this issue, for how media campaigns, like you mentioned, could be fielded as a way to really humanize this public health issue. Again, I think language is an incredibly important part of that, but really so are the visuals. And I think what we've been able to do with this paper is to contribute to our growing understanding of what are the factors that contribute to stigma and how can we reduce it.
Yeah. Thank you so much for sharing a little bit about your study and what you found through it. I'm wondering, just from where you sit too, since so much of it is public health and there's this little bit of connection between what you know about the issue and how you communicate or educate the public on it. How do the findings from your study make you think about how we need to reshape communication around SUD in public health?
Well, I think we need to move from shock value to human value. I know that's easier said than done. I recognize that. But it really shouldn't be about the clicks. Instead of images that dehumanize, for example, we need visuals that show the person behind their substance use disorder. They shouldn't be defined solely by one aspect of their life, but they're someone's, child, they're someone's sibling, they're someone's parent living their life. And for us to find ways as a public health community to convey their stories and communicate information in a way that viewers can connect with that person, with that human, I think is really key to us being able to, to reduce the stigma, to engage individuals who may be grappling with and struggling with a substance use disorder, and support them in seeking services. I think it really begins with being able to tell people's stories and humanize this in a way that viewers will understand. I think empathy comes from showing people with their family members or in recovery, rather than defining people by one aspect of their life or in a particularly vulnerable or their worst moment. Pointing people more like what the future might hold for someone or their potential as an individual. And I think those are the sorts of images that are so important in developing empathy among viewers, among people who might see these photos. And so just as much as I've seen campaigns that have emphasized sort of scarier, very negative, very dark images, I've also seen a lot of campaigns that have emphasized the human aspect of this, that have been able to promote empathy by showing people who are actively working, who are spending time with their family. We have a campaign in San Francisco right now called Living Proof that is really focusing on people, San Franciscans, who are in their recovery, talking about what it was when they were actively using and then what it's meant for them to be sort of in different stages of their recovery, but telling their story from an authentic way, in a way that I think allows viewers or audiences to relate to them and to say, that resonates. Maybe I could see my friend or my family member or my neighbor going through that. I can understand this a little bit better. And I think those sorts of, moments of storytelling and finding ways for our visuals to reflect the values or the ideas that audience members may have is one of the ways in which we will collectively be able to reduce stigma and more importantly, really increase that empathy that people feel.
I love that you mentioned living proof and the way it humanizes people who have struggled with addiction through storytelling. Listeners, if you're curious, some of those clips that you heard at the top of the episode are actually from Living Proof. But Jeff, I'm wondering, given what you've learned from your study about people's perceptions of substance use disorder, why is centering this campaign in storytelling so important for shifting perceptions around SUD? And what tangible results has San Francisco seen from this approach?
We know that stories change hearts in ways that statistics just don't. We're geared as humans to want to hear stories, to be motivated, to be inspired by them. And so I think for us, Living Proof, which is this campaign that features San Franciscans who are in recovery with a substance use disorder. So our campaign and other campaigns show that recovery isn't just possible, but that it's happening in our neighborhoods, in our workplaces, among those we socialize with. And so I think when someone sees a person who looks like them, doing well in recovery, talking about it, that can help move this needle and can help someone feel supported in making the decision to perhaps seek a service that could benefit them. And so I think campaigns like Living Proof and to your point, like, using stories as our way of changing people's perceptions are ways that we found have been effective in San Francisco as a way of, advancing the conversation. The stigma that we are confronting here is entrenched. It's been based on years of talking about substance use perhaps as a moral failing. It's based on negative imagery. It's been based on sort of really glorified or really harmful images in the media or in our movies that have really sort of set people up to view drug use as, again, a moral failing, when really we know that it is not. It is a medical condition that we have effective treatments for, that it is one facet of someone's very multidimensional life. And so how can we best, use the stories of people who are in recovery or who are sharing their journey to help counter those negative stereotypes, something that we want to keep doing. And so I think what we've seen since launching Living Proof has been, a greater awareness of the resources that are available to San Franciscans. Hopefully, it'll be a reduction in stigma. We've done some initial sort of surveying of San Franciscans to understand how do they perceive this issue.
Mm-hmm.
And I'm hoping as we build upon, sort of the work from our paper, and we find that this is an evidence-based way to hopefully, increase empathy, that we will continue to sort of see that in San Francisco and elsewhere around the country.
Absolutely. Thanks for sharing more about the campaign and, just like how you brought it together and the impact it's bringing. With the work you're doing in humanizing people with SUD, that reduces stigma and it also increases public awareness of SUD. So with that combination of effort, it might make people struggling with addiction or substance use disorder to feel like they can seek help. And you mentioned earlier in the conversation that you formed the Night Navigators program to help bridge people seeking help for, opioid use, SUD, to access San Francisco's telehealth buprenorphine program. So can you share more about what this program does and the impact it's seen, and maybe how you're seeing the importance of the work you're doing in the education, communications around this impacting the actual results and assistance you're providing to the people around San Francisco?
Sure. So, I think even in our fentanyl era that we're in right now, where fentanyl is so prevalent, we have effective treatments for people who are grappling with fentanyl use disorder. Methadone and buprenorphine are two of our FDA-approved medications for opioid use disorder or opioid addiction that improve people's health and reduce the risk of dying. And innovation, I believe, is needed less in the development of new medications, but more in the design and implementation of programs that help people access our existing treatments. And I think as a city in San Francisco here, we are committed to making these medications as accessible as possible through new and innovative ways. I think reducing stigma is so key in supporting individual in making a decision and perhaps seeking treatment, but then you need to have that treatment be as readily available to them when and where they need it. And so that was sort of why we as a city passed what we believe, again, is the first of its kind legislation in the country to require retail pharmacies to stock buprenorphine. And we think that's an important statement to make, that we are committed to making these treatments as available. But even with expanded, daytime hours of our treatment programs and more medications in our pharmacies, we recognize that it can be difficult for people, especially those who are experiencing homelessness, to access services during daytime hours or going to an appointment-based clinic. So our Night Navigator program was developed to try to solve for those sort of two problems. One of which is that we wanted services to be available into the evening, into the early morning on any given day, and that it can be brought to people where they are. And so I think there are a couple of factors that I'll just sort of say about our Night Navigator program, which I'm very proud of, and I believe that has made a difference and that we're continuing to improve upon it. But I think these are three things that I would sort of want to share about, is one of which is that we have incredible night navigators. These are individuals, these are peers who do proactive outreach. They are trusted community members who are going out, every night into the early mornings and engaging people, asking, are you interested in talking with someone about treatment tonight? And if so, they hand them a cell phone and they connect them right in that moment to someone who can do an assessment and perhaps prescribe a medication if appropriate. Those night hours, I think we found, have been key. It's connecting directly to someone between 8 and 2 p.m. at night in many instances, when people aren't used to being able to access services, but they welcomed it when it was, offered to them. Mm-hmm. And then we also have a very strong relationship with our pharmacy colleagues who help counsel patients and can even deliver the medications to them, during the daytime hours. We are trying to systematically break down each barrier that we have heard about or we have seen as a way of really engaging individuals and supporting them in getting these medications. And so I think with that sort of alchemy that we've sort of created there, with night navigators, with relationships with our pharmacy colleagues available into the early mornings, we've seen over the past year of engaging more than 3,000 unique clients, in that first year of our program alone. Half of the people who are prescribed buprenorphine actually get it, which is a much higher percentage than sort of national rates, national averages. And especially for people who are experiencing homelessness, for whom it can be, difficult to get to a pharmacy or to pick up their medications for other chronic illnesses. So I think it's a program that we've learned a lot from. We're eager to continue to expand. And it is built on, sort of what you mentioned earlier. It's built on the synergy of reducing stigma, increasing empathy, and then making services as available for people when and where they need it.
Yeah, and not to mention the aspect of meeting people where they're at.
Absolutely.
You could meet people in the community who, they may be ready to seek treatment. It may be harm reduction, but you could point them to the right resources and get them there, which is wonderful. As a provider yourself, someone who is medically trained, or just in your work in the public health sphere, is there a patient story or perhaps outcome that you've seen that really illustrates this power that we've been speaking about combining public messaging with access to services?
Yeah, so many stories. I'll say I feel fortunate to be able to practice in San Francisco here. I help staff our telehealth line, prescribing buprenorphine. I also see patients in one of our methadone clinics here. And I think it's a really important part of my work. And I think it really forms what I think about from a programmatic policy and communication side of things. But maybe what I'll mention here is just that, it's also been about our campaign and what I've heard from the people who were featured in our campaign, whose faces and quotes were on billboards and bus shelters throughout the city and on social media. The people who have been featured in our campaign have told us that people in their community have approached them applauded them for perhaps being in part of the campaign, saying how they've been encouraged to seek treatment or to offer it or recommend it to a family member. They've heard from members of their community that, oh, their neighbors started to see themselves in the campaign because they were in it. And that representation was so important to them. And so I think, as much as I value and I have patient stories, it's also stories like this. It's hearing from the participants and those featured in our campaign share about what it's meant to them to be able to now be messengers themselves, to feel confident and empowered to talk about their stories in a way that could help connect with others in their community and to build more bridges. But it's really stories like those featured in this campaign that really remind me of the power of, again, storytelling, of individuals who have lived and living experiences, really owning and leading a lot of this work that we do in the health department in partnership with the health department, because that is just so key to engaging individuals and increasing empathy.
Yeah. What I'm hearing from you too is this sense of hope as well. This can be a very dark topic sometimes. And when you could build community through the storytelling, that is also very powerful. So I love hearing that. We have a few minutes left, and I sort of want to look forward. You have a lot of evidence from the research you've done, about stigma reduction, about increased service use, about treatment outcomes. We know that treatment and recovery are possible when communicated right, when we meet people where they're at. So, based on the work you've done so far, how is this informing the next steps in your work in the city of San Francisco?
In so many ways, I feel again fortunate that I'm in a role where I get to think about the data that we do have, the science that we are fortunate to have, both locally and from, the research that's generated across the country and around the world that really informs, that can really be used to inform our programs, our policies, our communication material. And so in my current role as the medical officer for science and policy for substance use services in the San Francisco Department of Public Health, I really get a chance to blend all of these things together to really sort of utilize our data and the science in what I think and hope is the most effective and most beneficial way for our communities that are collectively as a whole, grappling with this challenging public health issue. And I would say just to what you sort of mentioned there is that I am hopeful. I think it is difficult. We have experienced a lot of loss. Thousands of people are still dying of unintentional overdoses across the country annually. And that reminds me, why it is that there is this urgency that I feel in this work. At the same time, I do remain hopeful. I remain hopeful because of the partnerships that we do have in the city here, the people that I see who are so committed and so innovative in this space to making a difference. And how is it that we can use their ideas? How can we incorporate their ideas of what some of our colleagues who are on the front lines, what are our night navigators seeing? What are the other new things that we're going to need to do as a city to generate more evidence? How can we, do new things to keep pushing the envelope? We've done a lot, but we haven't done enough. There's still hundreds of people who are dying in San Francisco of unintentional overdoses annually here. And so more needs to be done. And so I'm constantly sort of both optimistic and also feeling the sense of urgency to keep doing more. And when I say do more, it's it's going to be learning from and hearing from members of the community who are seeing this and thinking about this as well. And how can I, as someone in public service and in the government, really bring together, convene people to share ideas, to share best practices, so that we are continuing to advance the care that we have in the city, reduce the stigma that we're all seeing or experiencing both locally and nationally, and really ultimately, save lives and reduce the other harms associated with substance use. Because I think it is possible. It's going to take a lot of work, but I think we can do it.
Absolutely. I remember earlier in the conversation, you were talking about looking at what other people are doing, collaboration with the community, with other people who can help folks with suffering from substance use, like this is a very collaborative effort, and other communities across the United States are also trying to work on this issue. So just zooming out one last minute here in the end of our conversation, what lessons from San Francisco's approach here with SUD can be useful to other cities or states trying to build a bridge from the stigma to support that you've been working so hard on?
I think there's so much work that is happening across the country. This issue, substance use, overdose prevention, is larger than any one department, any one agency, anyone larger than any one city, state. It really is. It really is requiring us all to think collectively about this. For what are the ways in which we continue to engage individuals, support individuals who may be using drugs? That is very much, something that we think about in terms of recovery and treatment, but also with harm reduction. There are amazing harm reduction efforts that are going on across the country from which we're looking to too and learning from, that I think are just so important, with that idea, as you sort of said, of meeting people where they are and not leaving them there, right? It's also helping them advance their health and their well-being, helping them achieve whatever goals it is that they have for themselves. And I think I would sort of offer what we've been able to bring to that conversation from San Francisco is really that idea of making services as available as possible. No wrong door, no wrong time, no wrong place. We want that to all be available to individuals when they are interested in seeking services that we have here. Our night navigation program is one example of that. And that is, similar programs are also sort of being developed around the country that we are also looking to and learning from, both in sort of the formal sort of treatment space, and then again, sort of in the harm reduction space, which I think are really, two ends of this continuum that are equally important to really advancing our collective ability to save lives, to reduce harms that we do see.
It's been so wonderful to chat with you today about all the work that you've done for San Francisco. Like I said before, I know that conversations around substance use disorder can feel really heavy sometimes, but you've brought a lot of hope to the table, showing what works and that recovery is possible. So I really just wanted to thank you again for spotlighting that point in this conversation.
I appreciate the opportunity to be on here to have this conversation, and we look forward to engaging other folks in this space. So thank you.
Thanks again to Jeff for reminding us that recovery is possible. While SUD is challenging as a public health issue, I think we've seen today that when treatment is accessible, when care is grounded in evidence, and when we reduce stigma, we can create the conditions for an effective, recovery-forward public health approach. So I think it's time we stop asking whether we can help people recover. It's whether we'll choose to. Thank you for tuning into Empathy Affect. If you found today's conversation meaningful, please share it with a friend. Also, don't forget to follow and leave us a review wherever you get podcasts. To learn more about Jeff's work and the Living Proof campaign, you can find links and resources in the show notes. In the meantime, I hope you'll join me next time. Thanks, y'all.
Empathy Effect is a product of Forrest Marsh.